Happy Friday, everyone. We're about to get started. I'm sure we'll be getting some additional participants coming in as time goes on, but to be mindful of your time, and we have so much to cover that we're gonna get started. Okay. So hello, everybody. Welcome to our April Pull Up a Seat on Love Your Bones, bone health. This is such an important topic, and we're so excited to be able to share this information with you today. My name is Shonda Cooper. I am a Chief Program Officer here at Tigerlily Foundation. It is my joy to be your moderator and to be able to introduce you to a phenomenal group of patient experts that will share about their impactful stories and also sharing about their journey as it relates to bone health. We're excited to have you here and also to be able to share some information to help to educate and empower you as it relates to bone health. Little update so that you can see what's going on, what we're going to do today. We are going to have an introduction. I'm going to share, already I've done that a little bit, but just introduction on Pull Up a Seat, setting the stage and the space for us to have this conversation. And then we're going to dive in and, I'm going to give a presentation on bone health and share about that to get the conversation going. And then we're going to hear from our phenomenal group of patient experts about their experiences. These women will share their stories and journeys. And after we do that, we will have a collective exchange of ideas. Since we have such an intimate group, which is wonderful, we're going to be able to have a conversation based off of the information that I've shared, as well as the information that our patient experts have shared. This is an interactive conversation. So as I continue to provide information, as well as when our patients share their stories, please feel free to write in the chat. The more the merrier. It helps to just create that space of community that we so enjoy, and what Pull Up a Seat is really about. So welcome. After we do that exchange, we will, sort of have some takeaways. What did we learn? What are some actionable steps that we could take from this moving forward? And we'll have audience feedback and interaction. So throughout that, like I mentioned, if you're writing in the chat, if you have questions, please pose them. It's really informal. We'll be able to at least share, and you can interact with the patient experts as well as we go through that. So 5 agreements, how to be in conversation. We ask you to please monitor your airtime, speak your truth, speak from your own experiences, and lead with curiosity and not judgment. And most importantly, keep the space safe. Our why. For those who are new to Tigerlily Foundation, our why is really to help to educate, empower, and advocate for young women before, during, and after breast cancer. We have on the left, as you'll see, a phenomenal advocate, Shantae Randall, who is no longer with us, but worked so fiercely towards this message and being able to empower others. And she is one of our whys and our reason why we continue to do this work, to share, raise awareness, and provide insight to breast cancer, to provide information about resources as it relates to that, so that we can be empowered to be able to share and be able to live impactful lives. So Pull Up a Seat, what is it? We typically have a No More Disparities and a Pull Up a Seat component, but we've been having, typically the No More Disparities is more informal and Pull Up a Seat is more formal. Pull Up a Seat is when we have a bi-directional conversation with medical professionals, typically to amplify and share the voices of Black men and women through candid conversation about topics relating, it can range from racism to clinical trials to bone health. And discussing ways that we can move forward and being able to have that conversation with those who need to hear that as well from our end. So with that, I'm going to dive into sharing about bone health. Let me just, before I do that.
Shonda, I can't see anything on your screen.
I just realized that. Thank you. Someone just wrote that. I had paused my screen, and so you didn't see any of that. Appreciate it. Okay. Alrighty. So I'll just go back and share so that you can see the agenda that I just mentioned and went over in terms of the timing for everything. And then I shared about the agreements, as well as being able to share our why. And I shared a picture of Shantae as well. And then about the pull up a seat and no more disparities conversation series that we have. And then I am going to dive into now talking about bone health, which is why we're here today. So this month at Tigerlily, we've really been sharing a lot of information as it relates to bone health through different blogs and different speaking Twitter chats and different engagement, as well as having this pull up a seat to talk about this specific topic. When it comes to bone health, it's important to understand that building your bones, it begins from your childhood and it's through your adulthood. And that's by helping to, by getting calcium and vitamin D, as well as trying to ensure to do weight bearing exercises as well, to ensure that you're building your bones. The most important years for growing your bones are between the ages of 9 to 14, which we have all passed, but it's okay. We still have opportunities to continue to build on those bones and continue to do additional steps to ensure our bone health through nutrition and exercise. One thing that's really important that we want to share too is that anybody can get osteoporosis. Weak bones don't discriminate. So we would need to be mindful of that. And by the age of 30, you would have likely achieved your peak bone mass. So by building your bone bank ahead of time in your early years, that helps to, sort of ensure that you have enough bone mass for the years to come. Your diet is really important when it relates to bone health. Eating plenty of protein can help to maintain your muscle mass. Having fruits, vegetables, legumes, nuts, they all have lots of micronutrients that can help to support your bone health. Greens, having fortified beverages, canned fish as well are also some other areas or different ways that you can provide and get that support that you need in terms of nutrition. Leafy greens, vegetables, fruits, lean proteins, healthy fats. So again, like fish, omega-3s, and overall just having a well-balanced diet can help to preserve your bone health. Vitamins. There are some important vitamins as it relates to bone health. I think we've all heard at some point it's calcium, yes, calcium, but it's more than just calcium. Now, calcium is important because it is one of the fortifying vitamins that is needed. Also, the amount of calcium that you need in your body changes with your age. So that's something that you need to be mindful of. Trying to ensure that you at least consume at least one calcium-rich food per meal. And if you don't consume dairy products, then trying to find maybe a calcium supplement that you could take to ensure that you're getting the right amount of calcium that you need. Vitamin D is also another critical one. It's something that, yes, you can get from the sun and getting exposed to the sun. Now, I think we do have some people from Nairobi, from Kenya here, so they get a lot of sun. But for those of us in North America, even though we do have access, we are outside as opposed to the sun, we may not get enough we may not get enough vitamin D through the sun. So it's important to maintain that by, getting our vitamin D through supplements per se. And these are some examples of the amount that you might need, between 600 to 2,000 international units a day, but it really depends on what your doctor says as it relates to that. The National Academy of Medicine suggests having between 600 to 800 IU. But again, it really varies on where you are and what you need to take at that time. So it's really good to be able to get checked up and make sure that you understand what your vitamin D levels are. Since there aren't many foods that are rich in vitamin D. And then lastly, magnesium, which I love because it also helps you to relax. So this mineral, magnesium, helps your body to regulate that calcium and vitamin D. And it's found in vegetables and green vegetables, nuts and seeds, legumes, whole grains, and avocados. The recommended dietary allowance for adult men is 420 milligrams and 320 for women. Some of this information we did receive from one of our partners, the American Bone Health, who were part of our Twitter chat on Wednesday. So the impact of cancer treatment, the impact that the cancer treatments have on your bone health, especially as it relates to breast cancer treatments, it can help, cancer treatments can actually weaken your bone density. So it's important to speak with your healthcare provider about your bone density, what your risk factors are for osteoporosis, and how you might be able to mitigate bone loss. Some cancer treatments suppress estrogen for breast cancer, and estrogen supports the bones. So some cancer treatments can act like menopause on the bones, causing bone loss. It's also important to note that radiation therapy for breast cancer can affect your ribs and sternum. So it can actually sort of weaken your bones as well. And as we know, some chemo can actually cause early menopause for premenopausal women, which that can sort of have a domino effect as it relates to bone health. Some of the additional effects of cancer and cancer treatment on their body is hypercalcemia. So hypercalcemia is when there's a buildup of calcium. So calcium, as I mentioned earlier, is one of the building blocks of bones, but cancer cells release a hormone that can speed up the rate at which bones release calcium. That can cause hypercalcemia, which means that you have too much calcium in your blood. And hypercalcemia may be associated with cancer and could require treatment. So it's important to sort of note if you're having any symptoms such as nausea or loss of appetite, thirst, frequent urination, constipation, irregular heartbeat, or excessive sleepiness and confusion. If so, make sure to reach out to your provider and just share some of those and see. Ask just to make sure that that isn't something that you are experiencing. Another effect as well of cancer and cancer treatments are aromatase inhibitors. Aromatase inhibitors are hormone therapies used to treat estrogen receptor positive breast cancer in postmenopausal women. So these evidence-based treatments keep cancer cells from getting the hormones they need to grow. Some side effects of these inhibitors include muscle pain, joint pain, menopausal symptoms, and a loss of bone density, which can lead to an increased risk of fractures, broken bones. So as I continue again to go through this presentation, if there are questions or something that you find insightful, make sure to write that in the chat and we can discuss that or just, at least have that conversation as well in the chat. Integrative therapies and bone pain. So one of the areas too, yes, bone pain, that is something that is you're definitely going to feel at different times. But there are different treatments and different ways that we can sort of alleviate some of that pain. Acupuncture being one of them. We are strong proponents of acupuncture here at Tigerlily Foundation. Massages as well. I mean, self-care, right? Some of these are definitely about taking time out for yourself and ensuring that you are getting some of those, taking time to do those integrative practices that can help you. So acupuncture is one of them, massages, stretch therapy, yoga. I mentioned earlier weight-bearing exercises. So walking, jogging, dancing, Zumba, hiking. And why is it important to do weight-bearing exercises? It's because when you're doing weight-bearing exercises, you're putting stress on the bones. So by putting stress on your bones, that helps to trigger your bone cells to build more bones. That can lead to increasing your bone strength. This process is called osteogenic loading. So make sure to get out there. The weather is changing, I know, on this side, to be able to get outside and walk if you can, and sort of increase that bone strength. And then also it's important to work on your balance as well. And ensuring to see how are you able to balance? Can you stand on one foot for 11 seconds without being a little wobbly? If you can or can't, you may just want to try to strengthen that to ensure that you don't fall, with the risks, as I mentioned earlier, of treatment. Your bones can become weakened, so that could increase your risk of having a fracture. By working on your balance, that would help to then sort of reduce the risks of you having a fall. Now, as I mentioned about conversations with your healthcare providers, it's important to be able to schedule a specific appointment to discuss your bone health. There's so many different topics that we do discuss and talk about talking to your healthcare provider. Bone health, there's so many layers and there's so many different components, as you can see from what I shared earlier, that it may be beneficial to have a conversation specifically on that topic. That way you can get your questions asked, do any follow-up that is needed on the specific area. And if you can, and if you at the beginning of your treatment, it would be really, we recommend it'd be good to ask for our bone mineral density test so that you're able to know and understand over time, if you are having bone loss after getting that baseline reading. So it's a great way to then track on your own, be able to track and see what's occurring within your body as it relates to that, and being able to adjust and adapt accordingly. Conversations with your healthcare provider. So this is, you feel free to take a screenshot of this if you'd like. This is from one of our other partners, the Bone Health Foundation. This is the National Osteoporosis Foundation. They have a checklist that you can take with you if you'd like to your healthcare provider to ask about bone health and osteoporosis. So, some of the questions: do I have any risk factors for osteoporosis or fractures? Am I getting enough calcium? So you can make sure to write and share how much calcium you're getting per day. What kind of exercise are you already doing? What medications are you taking? Could those medications cause bone loss? That's a really great one to ask, as well as if you have any medical conditions that could cause bone loss, including what you're already currently are experiencing. And then finding out if your bone mass, your bone density tests are actually normal. What do the results mean? And if you do have osteoporosis or low bone density, do you need to take medication for it? And I mentioned this, how can I prevent falls? So that was one of the things I was sharing about as it relates to, trying to work on your balance and so forth. Another great checklist from American Bone Health is specifically towards talking to your healthcare providers if you're a breast cancer survivor. Some questions to ask too. I'll just highlight some. Should I have blood tests done to measure my calcium or vitamin D? Will any of the treatments or medications I'm taking to treat my cancer weaken my bones? What to do after you take a bone density test? Asking what is my risk of having a fracture? Are there exercises that you should avoid? Are there bone strengthening medicines that you can take to help to protect you from breaking a bone? Are there tests or exams that you should have before starting a bone strengthening medicine? These are all really helpful questions. So again, I urge you to screenshot this. I will also share the link to this document because they have an entire breast cancer survivors guide that would be really helpful for you to look at during your free time. And then if you have metastatic breast cancer, what are your risks of a serious bone complication or skeletal related event from metastases? What are bone mets? What are there ways to manage the risks of SREs? So these are some of the questions that, we'd like to, find out or share with your provider, your healthcare provider. Now that I've shared all that hopefully helpful information with you, I'd like to stop sharing my screen and introduce you to our phenomenal patient experts that are going to be sharing their stories with you today. Brooklyn Cobb, who is a 2-year breast cancer survivor who was diagnosed at the age of 28, and she will share her story. Evalyn, Allela, who is a breast cancer survivor and thriver who was diagnosed with TNBC in May of 2020. Latoya Dotson, who was diagnosed with stage 1 triple positive breast cancer, and has her own advocacy group, a local community called Pink Savvy. And Eboney Thompson, who is a woman of faith, mother of 4 amazing children, author, metamorphosis mind coach, and speaker, who has been a thriver since she was diagnosed with breast cancer, stage 4 breast cancer at the age of 37. So I'm going to stop this and I'm going to hand it over to Brooklyn to share with us her story. It's so great to have you, Brooklyn.
Hi, everyone. Can everyone hear me okay? Yeah, awesome. So super excited to be here. My name is Brooklyn. I was diagnosed a couple of years ago at the age of 28. And generally, in my 20s, bone health wasn't something that I was regularly thinking about until my cancer diagnosis, and I was kind of forced to think about it. The type of cancer I had was hormone receptor positive, HER2 negative. And so part of my treatment care involved being on hormone replacement therapy. And so the hormone therapy puts me in medically induced menopause. And with that comes a variety of different side effects and things. But one of the biggest things is that, my body no longer is producing estrogen. I'm on medications to block that. And so I'm at a higher risk for developing osteoporosis. So my bone health has now come into question. And so I was at a place where I was really starting to learn more about my bone health at that time. And one of the things that, as far as part of my treatment plan that I ended up doing was I had my DEXA scan like we talked about. Baseline, I did not have any osteopenia, osteoporosis, and I was going to be put on a medication that was going to help improve my bone health, which was called a bisphosphonate. The one that I'm on, it's an infusion that I get every 6 months. And, with that comes a lot of different things as well. But in thinking about my bone health, for the most part, osteoporosis, it's kind of considered a silent disease, right? Especially in more younger people. It's not like over time, I'm starting to feel my bones like ache, and then all of a sudden osteoporosis is here. It's kind of considered a silent disease. And sure, the older we get, we might see some more signs such as losing height, or if our posture is getting affected, or some people might have back pain over a long period of time. But in the general sense, for most young people, especially in medically induced menopause, we don't really see a lot of signs up front. So I really wanted to stay on top of my bone health and be proactive with that. And some of the things that we already mentioned, I had really started to be more intentional about in my life, such as weight bearing, exercising, making sure that I'm getting both calcium and vitamin D, not just from diet, but I also supplement that. And I try to be really intentional with taking care of my bones, and not just favoring any one particular bones, but thinking about your bones as a whole. So one thing I didn't think about as much is your teeth. Your teeth are bones, making sure that you're getting regular dental follow-up, making sure that you're caring for all of the bones in your body. And so, especially as a minority, I feel like in some ways I've had to advocate for myself in a lot of different spaces because, like I said, typically we're not thinking about someone my age getting osteoporosis, right? So even something as little as getting my DEXA scan that originally was not approved by my insurance company. They were like, why does a 28-year-old need to have a DEXA scan? And so having to go back to my doctor, advocate for that, have them recode it so that it shows, hey, this person's in medical menopause, it's medically necessary, it's appropriate, just to get that covered. So I've been learning a lot through the process. I'm still learning a lot about it, but I do try to prioritize my bone health because, God willing, I've got a lot of years left to live, and I want to make sure that my bones are supporting me, and I'm, going to be in a healthy place to have active bones so I can live an active lifestyle for many, many more decades to come. So thanks, everyone. I'm excited to be here. Feel free to ask me any questions. I'm an open book, and I will answer to the best of my ability.
Thank you, Brooklyn. Thank you for sharing that. Yes. And like you said, you can't discriminate. Don't favor any set of bones over the other. And I know there's some questions that I have that we'll definitely share later too, to hear more about your the medication that you're taking and that treatment every 6 months, all of those things. We'd love to hear more about that as well. So now I'm going to pass it on to Eva to hear for her to share her story.
Okay. Hi, everyone. My name is Eva, or Eva, as you wish. I'm from Nairobi, Kenya, and I'm really excited to be here. And I know Shanda mentioned that some of us have the luxury of having some extra sunshine. And it's a practice in Kenya as a whole to take babies out in the sun in the morning around 9 to 11 a.m. To have some sunshine. So we grow up knowing that the sun helps us to produce vitamin D for our bodies. But of course, this is usually not enough. We need to supplement with a good diet and sometimes even additional vitamin supplements for that. So my story is that I have never had a discussion about bones with my doctors. And, after I signed up for this. I started doing a little bit of reading up on bones and breast cancer. And the one thing for sure is that as women, we are already predisposed to osteoporosis as we approach menopause. And a diagnosis of breast cancer, additional treatments that we go through breast cancer increases the risk, but it's unfortunate that we are not told about it. So, we are just there living by grace and hoping that our bones are okay. So this has really gotten me thinking, and right now the top thing on my mind is for my next doctor's appointment is to ask about bones and demand for a DEXA scan, because I think even without breast cancer, without going through the treatment that may have compromised my bones, I'm already at an age where I need to start taking my bones more seriously. I got diagnosed at 41, and I'm 43 now. And, we never think about bones as much when we're young, because we are all active, dancing and doing all we need to do. And we only hear about bones from our elderly moms or aunties or grandmothers when they start complaining about back pain and knee pain, and when they start getting osteoarthritis and osteoporosis. And so just the fact that cancer brings an additional risk of this happening earlier, then it needs to be a very important component of our discussions with our healthcare providers. Just the same way everybody knows that you may have nausea, everyone knows that you will lose hair, everyone knows that you'll get fatigued, you're tired to death. Nobody knows that our bones are compromised once we get diagnosis and when we start getting into treatments. Well, and then also more specifically for TNBC, because we don't get treatments that suppress estrogen, then I think it's an assumption that our estrogen is okay. But the chemotherapy alone puts us into chemopause, and that already has lowered our estrogen. And then secondly, for example, I've been talking to my doctors about having a double mastectomy plus oophorectomy, meaning that my ovaries will be out, and so I'll not be producing estrogen. And when we had this chat with my doctor, when I asked her, so, what is going to happen? Bone health didn't come up. And I think with my ovaries out and no estrogen production, it means that it'll be a big deal for my bones. So I'm glad to be here and to participate in this very, very important conversation. And we just need to make sure that bones feature loudly and boldly in all literature that accompanies breast health and breast cancer, and so that we are not just focused on hair loss is a big deal for us, but even bone loss, bone health, we need to be able to run around with our grandbabies later on in life. So we really, really, really must put bone health at the forefront of our discussions around breast cancer and its management.
Absolutely.
Thank you.
Thank you, Eva. So great to hear that. And I just love the gusto that you're just, you're sharing your story and just explaining too that, especially it's so timely to be having these conversations, especially with what you're going through, what you plan on going through in terms of planning. You're looking at the future, what you plan on having these different treatments, and being able to have a conversation about your bone health as a result of these steps that you plan on taking is so important. So thank you. And if you have questions or, please feel free to write them in the chat, and we'll definitely get to them after we hear from all of our phenomenal ladies. So I'm going to now turn it over to Eboney to share her story.
Good morning, everybody. Hello, can everybody hear me okay? I hope so, because they're having construction outside of my apartment. Well, my name is Eboney. I am a mother of four. I was diagnosed in 2018 with metastatic breast cancer. So I'm at that last stage, and I was at the last stage when I initially found out. For me, what's crazy is when my cancer had metastasized, it had went from the breast, it also had got in my lungs, but it also had got on one part of my bones. It hadn't penetrated all the way, but it was also in my bones. Now, you would think because it was on my bone that they would, my doctor at the time would do so much and tell me about my bone health and what I needed to do. And he did none of that. When I say he did none of that, he told me about, my hair loss. He told me about I was going to probably get sick. He told me all of the normal stuff that, you could just see in a movie. So it took me to actually do the research, instead of staying up at night, Netflixing and eating, I was Googling. And I was like, I Googled so much. So the next time I went for questions to my doctor's appointment, I would always question, well, what about this? What about this? What about this? And in my questioning, in my advocating for myself, this is when I found out the doctor that I had was no longer the doctor that I needed. Because I would ask him questions. He was like, oh, we'll worry about that later. I'm a mom of 4. I need to worry about that now. My health right now is very, very important to me. And I need to be up and be able to run with my kids and walk with my kids. And so I later, after a couple of treatments with him, I changed my doctor. And the doctor, by the grace of God that I have now, she is very attentive. And anything, any questions that I have for her, she answers. It was her that, she told me, we do bone testing every couple of months. She always asked me, well, okay, well, is your pain, how's your pain? Is it, because of the chemotherapy? Is it because of this? Is it because of this? Okay, well, if it is, let's try this. She's always on top of it. And I'm very inquisitive. Every time I go in and for a checkup, I continue to have questions because it was then in the beginning that I found if I don't speak for myself, if I don't talk up for myself, nobody's going to have my back like me. And so when I take quite a few supplements. I changed my eating habits completely. I'm more on the vegetarian side of everything. And so even with that, I pay attention to what I'm putting in my body. I'm fortunate I live in California, Southern California, so it's almost sunny 365 days of the year. We very seldomly have rain or clouds. And so I'm able to go outside and activate that vitamin D. But I take my health very seriously, my bone health, and now I'm passing it on to my children. When I came in, when I came into when I got diagnosed, it was more they asked me questions about, what about has your mom ever had cancer? Has your grandmother had very cancer, any kind of cancer? I was the first. So I feel like it's my responsibility to not only share what I'm going through and what I do, but I also share it with my children. I also share it with my friends. And that's how my asking my mom and my grandmother is like 50 million questions. Like, why does your back hurt? It's because I know my mom, they went into menopause early. And that's something that, I share with my doctor. And that's something that we have worked into my treatment even continuously now. So bone health has been a big thing for me. I'm a heel wearer. I love my shoes. And so I told my doctor I have to be able to wear heels until I'm 80. So I have to be able to stand on them. So I make sure that I get out, get my exercise in, and make sure that I'm eating the foods that I need and taking all my supplements and getting out and getting my sun, my sunshine, so that I can maintain great bone health, as well as just being able to advocate for myself. If I tell anybody anything, ask the questions, find out the questions. If you don't know them, Google it. Somebody didn't Google it before. So you make sure you do that.
Thank you, Ebony. Yes, and there are so many people who are with you on that. Some who miss wearing their heels. There are healers as well. I love that. Healers in the chat who, yes, would love to hear more about that and how you're what some of the practices that you're doing so that you can continue to do it. And thank you for just sharing your story and your journey too, and about, you know, just being a light. So we really appreciate you and appreciate you being a part of this program. Thank you. So I'm going to pass it on to our last speaker before we open it up for conversation, Latoya.
Hello, ladies. Can y'all hear me?
Yes.
Okay. My name is Latoya Dotson. I was diagnosed with stage 1 triple positive breast cancer in February of 2019. My hair is doing some crazy stuff. Sorry. I actually had my breast cancer nonprofit organization 5 years before I was ever diagnosed, because my mother-in-law and I launched it together. She was diagnosed with stage 3 triple positive breast cancer. And I had no family history of breast cancer whatsoever. So when I got diagnosed, I actually did not feel a lump. I thought I was having some circulatory issues, ended up going to the heart doctor, and he performed all of these different tests on me, and the nodule showed up on a heart CT scan. And he was concerned that it was maybe just calcifications, sent me to get a mammogram, and turned out to be stage 1 breast cancer. I'm thankful that he went beyond the call of duty on my behalf, because he could have opted to just say that, you know, your heart is fine and, you know, you're good. But instead, he actually sent me a referral over and got me a mammogram and, you know, got the ball rolling. And so I'm thankful for that, because the cancer was estrogen and hormonal, as well as the HER2 positive, which I had to take the Herceptin for a year. It impacted my bones pretty heavy. I am also 40 years old. Well, now I'm 43 years old, but I was 39 when I was diagnosed and went into treatment at 40. And so working alongside these women, I never heard them talk about their bone health. And most of the women that I worked with were African-American women. And they always would say, you know, they ate, but it seemed as if nobody dug for the solution. I would hear them always talk about, well, I take Claritin, and that seems to help with the aches. But after I got diagnosed, and like I said, the doctor really never gave me any heads up on anything that I would face besides possibly going into, you know, chemo-driven menopause and the hair loss, but nothing about my bone health. And so when I began to have aches in my bones to the point of where I could barely stand, it almost was like my knees were giving out. I started to do research. I also contacted a naturopathic oncologist to get some help with what I could do to try to restore the strength that I was losing. I had a couple of bone scans in which I had to ask for, even after complaining to my oncologist that I was dealing with this. And that's when he said, well, it's possible that you could have weakness. It's possible that osteoporosis could set in, but there was nothing that he gave me to help, you know. He never gave me a solution for it or a suggestion for a solution. And with the research and alongside my naturopathic oncologist, she recommended, of course, that I do some weight-bearing exercises, which sometimes I was really too weak to do. As far as hiking and rebounding and lifting some weights. I ended up really having to buy the weights that you kind of, I don't know if you guys have seen them, that you can Velcro to your arms and your ankles, where I could just kind of, in my everyday movements, move my arms and hands around with those like 2 pound, I think they have sand in them, weights. And those helped me gain and build my muscle strength a lot, just doing that on a daily basis, to the point where I was able to go back into the gym and lift like 5 pound weights. And of course, I added supplements to my diet. I added the vitamin D3 as well as the K2, which helps the vitamin D absorb into your bloodstream the way it's supposed to. I added magnesium as well as calcium to my diet. I didn't become a vegan, but I did change my diet plan to pescatarian lifestyle, which I just eat salmon and red fish, and along with my vegetables and my fruit. And that, I must say, has helped me a lot. I also dealt with inflammation, so I couldn't consume any dairy because dairy always made it worse for me. I still deal with some bone health issues that I continue to work on. I refuse to give up. I am still believing for complete restoration of my bones, and as well as my muscles and everything else that was impacted by chemotherapy. But yes, I feel like this conversation always needs to be at the forefront, because there's so many of us that don't know, going into chemotherapy or whatever treatments we may get, radiation, that it impacts our bone health the way it does. And so I'm excited and thankful that I get the opportunity to be among some amazing women that are paving the way for those to come, and those that have actually are dealing with this now, to educate them on what we can do to help and keep our bone health. And so I go to Clubhouse a lot, and they always say I release my mic, but I'm going to mute my mic on this one.
I love Clubhouse. Thank you, Latoya, for sharing that. And I'm just going to bring everyone on so that we can see everyone's faces, all of our wonderful speakers. Thank you all for just sharing about your experiences as it relates to this. I'm going to open it up if there are any questions or comments that anyone may have to our speakers before I ask some questions. So if anyone in the audience would like to ask, please raise your hand, or just unmute your mic and ask the group, and we can talk about it, as well as our speakers that are on as well, patient experts. If there are other things that you related to that some of the other women said, feel free to phrase that as well. Yes, Eva.
The question is for Mexi. She said that she's not on estrogen therapy, despite having the oophorectomy. So how do they manage, the lack of hormones and, everything that goes on in the body once the ovaries are removed? I'm interested because I'm headed there. So, it'd be good for me to have some information in hand.
Good question. Nothing. So I had to ask, sorry, y'all, I look like death warmed over, which is why I'm not on the screen. I had to ask for a bone density test because I was like, okay, now I'm over 40. I was originally diagnosed at 39, and then my body just will not metabolize tamoxifen. Avista wouldn't metabolize Lupron injections, so they had to force me into menopause and try and take those medications. And since my mother is an ovarian cancer survivor, and it looks like I was headed that way, they were like, we need to not only have a hysterectomy, but we need to take everything out. And so I was like, okay, so I get that I cannot have any estrogen. So what are we going to do about it? And not one doctor all this time has offered any solutions. I just found a natural solution called Amberin. There's no estrogen. It's drug-free, gluten-free, and I'm on my 7th week of it, and I actually feel like different in a good way, because that was my biggest fear, is I can't have any more estrogen. Than I know I have a small minimal amount, but we do not need that growing into cancer. So that's really it. And when I got my bone density test, it came back as, fine and normal, but I'm thinking to myself, well, gosh, I wonder, like, we didn't do one at the beginning before I started treatment. So there's really no clear baseline. So unfortunately, I've kind of been on my own, which is why I was so interested in coming to this, to hear what others were doing and what other solutions are, because none of my doctors have mentioned for those who had estrogen positive cancer, what they should take for their hormones.
Thank you. Yeah, go ahead. Oh, Latoya.
I also had to have a hysterectomy. After going through chemotherapy, I tried, I didn't want to do it, but I ended up having some calcifications in my uterus and cervical area. And then they were just like, you gotta, go ahead and get this done. And my naturopathic oncologist, because they say you still have some testosterone that transfers over and turns into estrogen in your body, just small amount. My naturopathic oncologist recommended that I take 3 tablespoons of ground flaxseed every single day. And that equates to you taking tamoxifen or letrozole, or the other medications. Of course, I still take the letrozole. I had to come off the tamoxifen because it affected me to the point where I couldn't walk. So the letrozole is much better. I don't like the moods on the letrozole, but it's so much better than the tamoxifen. So I can deal with that. But yes, she recommended adding more protein to my diet. And I must say it has helped me a lot. So if any of you have to have a hysterectomy and have any type of hormone-driven cancer, the 3 tablespoons of ground flaxseed, which you ground yourself, don't buy it grounded, organic flaxseed, put it in yogurt, smoothies, whatever, it does help the body.
Thanks, Latoya. And I had a question for you, actually, following up to what you were just talking about too, is how did you find a naturopathic oncologist?
I actually found mine on Clubhouse.
Okay, because I was wondering, like, when you said that at the beginning, I was like, hold up, we're gonna come back to that because I'm curious about that.
Yes.
Find that. Okay.
If you ladies are not on Clubhouse, like Clubhouse literally helped me get through my process. Coming, just finding out so much information that you can do for the body naturopathically to help you through chemo, as well as after the process, help your body heal. Because like I said, my Western medicine oncologist did not have a suggestion for what I could do for my body to help with the hot flashes, nothing. So if you don't have one, do some research. I have an amazing lady. Her name is Dr. Sam Price. You can look her up. So naturopathic oncologists have to go to school for Western medicine and for naturopathic medication. So they are both well-versed.
Thank you. Yes. Could you share her information or share in the chat too, at least? So at least I think that would help with the different people just trying to get started on trying to find some of those. And yeah, so Clubhouse Clubhouse is for those who are unfamiliar. It's an audio, an app that is voice, but nothing's really recorded. You just have these little chat groups that you come in, you have conversations about different topics. And I love to hear, Latoya, that you've been able to, it's been such a resource for you in terms of getting information as well. So that's good to know as well, even for us at Tigerlily, because we're always trying to find different ways to engage with different audiences. I know we started on Clubhouse, but we haven't been as active. So it's good to know that you're getting that from that space too. So I'm really glad to hear that. Okay, any other questions or comments? I know this is so good in just terms of getting tips and sharing information already. So I'll stop talking and give you all opportunity.
One thing that I will say, in my 9 to 5, I'm actually a pharmacist. And so I think that's given me almost like a slightly added benefit to the approach of some of the medication treatment options. So like I was saying, my cancer was hormone receptor positive. So I've been on hormone therapy. The two big ones that we typically think of are tamoxifen or the aromatase inhibitors. Aromatase inhibitors being like anastrozole, for example, which is the one I'm on. And they each have generally similar side effects. Like you're going to get the hot flashes with both. You're going to get, some of the sexual dysfunction side effects with both, but they each have their own one-off side effects. And one of the ones that I was interested in when I was, considering my bone health was which one is going to negatively impact the bone health more. Tamoxifen, actually, there's been some data that it actually can have a protective effect on your bone, whereas some of the aromatase inhibitors, like anastrozole, can have a negative impact. For personal reasons, mostly I was having a lot of weight gain with the tamoxifen and there's less with the aromatase inhibitors. I ended up switching with the known notion that the aromatase inhibitors can negatively impact your bones more, so more likely to have fractures and things like that. Because my doctor was really proactive with staying, I had my baseline DEXA scan, and we've been really staying on top of ways to protect my bone health and monitor it while I'm on this medication. I felt safe making that transition, but there's so many different things to think about when you're thinking about your medications too, because they don't all have the same risk for every different side effect. So asking those questions to your doctors as well can be really helpful. Because sometimes they don't always are forthcoming about it. But, if you ask them, they'll have to tell you, but they might not always share it kind of in the beginning. So that's just one thing I wanted to share.
Thank you. Thanks, Brooklyn. I know one of the areas that we also, Ebony, were you about to say something?
Oh, I was one of the things I wanted to share because I'm big on naturopathic because I have a naturopathic doctor too. Shouts out to him, Dr. Richard. Uh, love him. He's one of the ones that he helped me stay in my heels. Uh, but one of the things that I researched, and it was a blessing because it was somebody that I actually worked with. Um, um, I started infrared therapy. I've been doing it for 3 years. So it's the infrared therapy. We have here in Southern California, we have a place called infrared sauna. And so it's light therapy. And it has done wonders. It's like you sitting in a sauna, you're just sitting under light therapy. And the light that helped me the most was red lighting. And it actually has helped along with really help with my bones. Like I would go in and I would take my my vitamin D or whatever, and then I would go there. And we have found out that in combination with like the different vitamins and going to see definitely my oncologist, but also my naturopathic doctor, the infrared lighting and the infrared therapy has actually really, really helped.
And how often do you have to go for the infrared therapy, and how long did it take for you to actually feel some sort of difference?
It took about 2 months for me to actually feel a difference. I actually did it when I was when I first started chemo. So when I first started chemo, it was very, very new. I was going every 2 weeks. Now I go, I still go fairly often. But for the last couple months, I've only been able, because of my schedule, been able to go like once a month. But it really, for like a year, I was going every 2 weeks, and it helped build my strength. It helped definitely with the bones because one of the medicines what I was on, I would go take chemotherapy, but then it wasn't the I forgot which the name of the medicine, but it pulled from my bones to help. The medicine pulled from my bones to strengthen me, to help with my immune system. So I would sometimes be down for like a week or two. And as a mom, I can't be down. I got to get up and run with the kids. But I found that when I did the infrared therapy in conjunction with that, it lessened. I went from being down for 2 weeks to being down maybe 3 days. And so infrared therapy really, really helped me.
Wow. I see Latoya a lot nodding too. You said, Latoya, you said that you did the same.
I did the same. I did infrared therapy as well as acupuncture, and they do sell biomats, infrared biomats on Amazon. And they sell them in other markets too. And so I bought a small one. They're kind of pricey. I bought a small one just for my back. During chemo, somewhere in there, I developed a cyst in my spine, and it created a bulging disc. And so when I tell you that mat has helped me, I get on it and I just lay on it sometimes for 20 to 30 minutes at a time. And it does wonders for my back. I really could not bear to, like how I'm sitting here. I would be moving, I would be trying to get comfortable. But since doing the infrared therapy and using the biomat, I have been able to sit and be still and be good and attentive for hours at a time. So it does work.
Wow, thank you for that. And I know that I also saw in the chat, we have some acupuncture people as well in here. So can you all chime in about how acupuncture has been helpful as well for you?
For me, I actually just recently started. I went to the virtual San Antonio Breast Cancer Consortium meeting, and as like a Tigerlily advocate, and there was a whole section on all of these different non-pharmacological treatment things that you can do in the literature out there. And there's so much robust data on non-medical or non-medicine things that you can do. And so I was actually pretty impressed with the acupuncture data. And so I said, you know what, like, I'm in Houston, I'm in a big medical area. They have, so when I looked into it, so many different places. And so I found some places down here. I just recently started, so I've been doing it for about, I guess almost a couple of months now. In the beginning, it's not like one session and you instantly just notice this big difference. It's, you know, multiple sessions that you'll continue to go back and do, but over time you start to notice a little bit of a difference, especially if you've been having some like back pain or things like that. So I'm mostly just doing it for overall bone health, and overall a lot of, actually not even just bone health, but a lot of other benefits can come from acupuncture. And so I've been trying it for a lot of different things, but so far so good. Definitely a proponent, and I'm interested to see where it goes.
That's great. You know, I'm curious, you know, as well, because I know you're hearing about, you know, naturopathic doctors doing these, doing acupuncture, infrared, you know, therapies. Are any of these covered under your insurance? How are you going about trying to pay for these things?
For me, no. Most of the stuff is not covered by insurance, which is honestly, it's a shame. I've heard of some people where they have had it, you know, some people who work for these private like tech companies and other companies that have this phenomenal insurance plan that really, you know, hone in on those types of things. My insurance does not cover it. So I've had to pay for a lot of it out of pocket, but for me, it felt pretty worth it, even though it was a financial sacrifice. But I've also applied to some grants and things like that. There's so many opportunities for assistance for things like this, funding programs and things. So yeah, for me, no, but I hope that it's been different for some of the other ladies as far as getting this stuff approved.
Any other ladies want to chime in on it?
I hadn't been able to get it approved on my insurance, but I've actually connected with a lady that is working with a program in which they will reimburse you for it. So when I get this information, I will definitely hand it down.
Yes, please pass it along and we'll share it as well.
Yeah, I know for me, it was out of pocket. It was an out of pocket cost. It is an out of pocket cost. But by the grace of God, the lady who owns the facility where I go to, she actually works a deal out with me. So I'm able to get like a package deal. So if I have, like she did a package with me, especially when I was coming every 2 weeks, that like her normal price was like $120. She only charged me $30. So that also worked out. There are like there's a couple of foundations that I have to find them that will help you with this. Now with acupuncture, because I used to work for an insurance company, there are some ways to get around that. They have to find it medically necessary, and your doctor basically need you for the insurance company to cover it. Your doctor needs to ask for a peer to peer. If your doctor asks for a peer-to-peer consultation with your insurance, because all insurance companies have a doctor and some kind of other health professional on staff, they have to. You can actually get it. You can actually get it covered. Yeah, but they have to ask for a peer-to-peer. That's the only and that's with any kind of medications that your insurance company may deny. Don't even go to overpass grievance and appeal and ask for a peer-to-peer, and they'll cover it just like that.
Thank you for those gems, Ebony. Definitely. Any other questions as well for our phenomenal panel?
Like, what do you suggest? I mean, if we've already had a bone density scan and post cancer, we're in the survivorship stage, like, how do you know when to have another one? I feel like none of my doctors, like, it's like I had it, it was good, and then it was like, okay, peace out. And it's like, I just haven't had time because I've had so many other issues that were just kind of taking, more of my time. But now I'm thinking more about this. It's like, how do I know when to go back? Because ideally, I don't want to go when there's, a problem. Like, I'd like to catch it before it becomes, something too big.
Yeah, I'm wondering if, I know Brooklyn, you mentioned about you go every couple of months. If you could share a little bit about that, since you're on medication as well that is related to that, could you just sort of provide some insight on your experience? Maybe that might be helpful.
Go every couple, you're talking about the acupuncture again?
No, didn't you? I think that you mentioned that you were that you go for bone testing every couple of months.
Oh no, that was,
sorry.
who's that? Was that Eva?
No,
I go every,
okay,
I go every 6 months.
Every 6
But
months.
I remember someone else said every couple of months though. But yeah, I go every 6 months.
Okay, and why do you go every 6 months though? Is that what you were told, suggested, or?
It was what was suggested by my medical oncologist.
Okay.
So in the beginning, when I established care with my medical oncologist, we sat down and we made a whole plan for every single test I needed. So I know how often I need to go back to get routine blood work, how often I'm going to go and get my scans, how often I'm going to, I have an itemized, not like an itemized list, but I know exactly when all my stuff is due. So that way, because I told her in the beginning, I was like, I'm a very anxious person. I don't like sitting at home wondering what's next in my treatment. I like to know up front, what is going to be expected. And so I had my doctor sit down and do that with me. But that was what was told by her.
So you did have, at least your doctor at the beginning talked to you about bone, taking your bone density, taking the test and all of those things and coming up with a plan. Okay. Did anyone else have that experience with their doctors?
She also wasn't forthcoming, let me say. I had to
okay.
I asked about all these things. Yeah.
Okay.
Same. I had to ask my doctor about a ton of things. I really, I go every 6 months. So, and you would think because with being mine had metastasized and actually had metastasized to the bone that my first doctor would hey, I asked him for a bone density test, which was crazy. And he was a whole nother case, so I left. But even with my doctor now, I'd be like, hey, isn't it time for me to go get the test? And she's like, oh yeah. Well, I know you have a ton of patients, but I'm gonna look out for myself. So, I stay on top of her because I'm on top of it. But yeah, even like I said, having it spread to my bones, you would think that the doctors would have been on top of it more than
Right.
anything else. You would think that they would have pretty much, they would have said something about that particular treatment, but they did not. Everything was nausea, telling me different side effects. And even like some of the medications that I was on, the chemos, actually was affected my bones. So you definitely have to be an advocate for yourself. Because if you don't, they're more than likely they're not going to say anything.
Thanks for that, Ebony. Yeah, that is so unfortunate. And, it's just, I mean, the fact that, like you were saying, because especially with your case, that the fact that you still have to say, hey, aren't I supposed to be doing this? And then they sort of like, oh, yeah. I mean, there's so much that you're already dealing with that you have to balance all of this as well, is just, it's just a lot. I'm curious, I know Brooklyn, you mentioned about having like this sheet, like, or having all these things sort of that you can monitor or check out. How have you made it so that it's easy for you to do that and follow along, like track all of the different, your different time calendar to make sure you go every 6 months to do all these things? What practices do you all have in place to ensure that you stay on top of your health in that way?
So I know some people like to keep everything electronic, but I'm like a pen to paper kind of person. And so like a generic planner that's got like all of the whole year planned out from Target, like I buy one every year. And I have one that's specifically for like healthcare related things, all of my appointments. So like to the date, every 6 months, I get my Zometa infusion. I have like 6 months from now marked on my calendar. This is the date of your Zometa infusion. And in the beginning, it's got like spaces for notes. And so like I have a whole page that says Zometa infusion every 6 months. CBC chemistry, Chem 7 panel for blood work every 3 months, dental cleaning every 6 months. And it's like broken down into different buckets because I like to just visually see it all in one space. So I know kind of like what I should be getting done every few months. And then in my planner, I make sure that I have all those appointments already like scheduled ahead of time. So I'm not like, oh crap, like when was my last Zometa infusion? Like, did I make that appointment? Like, when am I supposed to go again? That just helps alleviate a little bit of the anxiety that comes with cancer survivorship. Just knowing kind of what I have to do and like having a book that I can see it all in one space. So that's kind of how I stay on top of it. And it helps me when I'm going into my appointments to not forget to ask questions about things. So like if I'm talking about my bone health, do I need to be getting my calcium and my vitamin D levels checked? Or is this something that like we can just go off the bone DEXA scan and we just go from there? Like, is it enough that I'm supplementing with calcium and vitamin D, or can I get away with just one? And so like, we'll have those conversations about what the evidence says. And I go in with a little bit of reading myself to the appointments, but I'm also expecting my doctor to be able to have that conversation with me. And to be honest, I've switched doctors. Like if I don't feel like you can have a conversation with me about what I should be doing, or if you're confused, or if you're like, I'm asking lots of questions you don't really know, or it's kind of, I don't feel confident in your responses, I'll switch doctors. And I've switched. I'm on my third doctor right now. And it's not like I just arbitrarily choose. Like I'll go to the community, I'll ask others in the area, like, hey, anybody in Houston, have they found like a medical oncologist that they love that really listens to them? And then I'll find doctors through others in the community that way. But I will switch doctors if I don't feel like I'm being heard, or if I'm not getting all the information that I need, or if I don't feel confident in that you're also taking care of me the way I would try to take care of me if I was taking care of myself. So.
I know that's right, Brooklyn. Yes. I know there are other people who are talking about paper. Are there any other people what other ways do you all stay organized as it relates to trying to keep track of all this different information? If anyone would like to share some tips.
I'm definitely like Brooklyn. I have like 3 different planners. I have 3 different planners. I have a physical pen and paper. Everything's color coded. So when it comes to like any test that I have to do as far as like breast cancer health or anything like that, I actually write it in pink. So it stands out very boldly. I also have a digital calendar that because I have 2 older kids, my oldest daughter is 19. So I will send it to her just in case. I set alarms on my phone. I have it digitally pop up on my phone, on my iPad, but I also send it to her. And before my doctor's visits, I will sit down and I will be like, okay, what questions do I need to ask this time? Did they answer my question the way I would understand it properly last time I asked? And then, as you know, going through chemo brain is real. They don't tell you, they don't even talk. I had to find out by Googling about chemo brain because I thought I was going crazy. And so I definitely write everything down. And even if I have to ask my doctor 2, 3, 4 times until it's ingrained, I will. But I'm like, Brooklyn, if you're not understanding me or I don't feel comfortable, then I will get another doctor in a minute, because I host a thing on YouTube called Pink Sister Chat, and it's all breast cancer survivors and thrivers. And most of the women that I've talked to, some women that is not even here anymore, the reason why they even got into situations and stuff that they did is because, oh, I talked to my doctor, but they really didn't do anything. And they didn't really have the boldness or the courage to say anything. So they got swept under the rug. Well, I'm not one you're going to sweep under the rug. So, and then I unfortunately was misdiagnosed in the beginning. I felt a lump in 2015 in my home state of Kentucky, only to later, what I found out in 2018 that it had metastasized to stage 4, when at the time it could have been controlled. And I went to a doctor for a whole year, only for them to tell me it was dense breast. I had nothing to worry about. And then I go into the emergency room for shortness of breath and came out with a diagnosis 2 weeks later of stage 4 breast cancer. So you're not going to sweep me under the rug. So you definitely have to be an advocate for yourself. But yeah, my pen and paper and all my several different planners, yeah, that's me.
No, that's right. Ebony, someone asked in the chat, can you please share your YouTube, your conversations that you have? Can you share that in the chat as well so that we can be able to follow along with that?
Yes, I will put my YouTube channel in there. And then, and I'm looking for some new people because I'm going to start up in June. Yeah, in June. Yeah. June is what's on the calendar. I'm going to start in June to start doing that again.
Okay. And we have a question in the chat too about anyone having joint or bone aches after using anastrozole. I'm not sure if I pronounced that right, but is there anyone who's had that?
Yep.
Okay.
So I'm on that medication. It's a known side effect. It's much more than with tamoxifen, for example. And it's just, my doctor even talked to me about it. She's like, it's going to happen. It's not a matter of if. It's not a matter of if, but when. Most people usually get it after like the first 1 to 2 months being on the medication. And all of the things that we talked about before, just trying to be more proactive about it. Honestly, physical activity has helped me the most, because in the beginning, I'm like, oh, everything hurts, like my joints, my bones, like I'm cracking. And like every 5 seconds when I move, I'll sit down on the couch and I'm like cracking when I get up. But honestly, moving has really been helpful, and stretching. And so naturally, you want to kind of not move when you're feeling like that. And you want to just kind of like put off exercise and moving and stretching. But forcing through that initial part to, try and get at least 30 minutes in a few times a week, I found it to be very, very helpful, along with stretching.
Brooklyn, thank you for sharing that. I was not menopausal. So they had me on shots after my cancer treatment to put me into menopause because my cancer was hormone sensitive. And then I ended up having a hysterectomy because of other issues. But and I'm thinking I'm going crazy or losing my mind because it's like it kind of sometimes feels like carpal tunnel. And they're like, you just have carpal tunnel, but it's starting to radiate up the arms. Mm-hmm. And my husband is concerned. He's like, maybe you should ask him if you should be taken off for a couple of months. But my concern is if I get off, I think I'd rather live with the side effects and work on the workouts and the stretching, but I appreciate you sharing that.
Along with, like, in the package insert of the medication, it'll call it musculoskeletal syndrome with associated carpal tunnel syndrome. So you're not crazy. It definitely, that's exactly what it is. Like in the morning time, I feel it in my hands. I'll wake up and my hands just feel like fixed in this position. I have to like stretch out my hands. Like it's not even just like knees. And I feel like when people think of joint pain, they typically think of like your knees, but it's joint pain all over. It's like the knees, the ankles, the back, you know, so you're not crazy. And carpal tunnel is definitely one of the side effects of that medication.
Well, they lock and you can't open up, and then they pop. And then like some of the people I worked with, one of the gentlemen, he's like, oh yeah, it's trigger finger. You get a surgery and you fix it. But I just feel like I have trigger everything. So I really appreciate you guys sharing your experiences and the opportunity to be here, even though I caught you late. Thank you so much.
Thank you. Thank you for sharing that too. And yeah, we will be sharing the recording as well on our YouTube channel, so you can be able to catch up and share some of this information as well. I know that one of the areas, there were one other things I wanted to talk about before we sort of wrap up. And that was, I know we talked a little bit about, you know, our hearing. I think Eva was talking about, we hear from grandmothers or mothers, oh, these aches or these old aches and pains and these kind of things. But there's also a connection when we talk about family history, you know, as it relates to this. So I'm curious if you've had any conversations. I know that I did hear in during some of your stories sharing that you sort of try to ask, you know, if you hear ache or pain, have you all had those conversations with some of the women in your family, or sort of taken note now? Are you more aware of those when you hear about someone saying, oh, this aches, or my back aches, or this thing?
I can say my mom and my parents are still living, thank God. They are 70 and 71. My mom, she actually began to be proactive after I was diagnosed with her bone health. Because she would often say, like, oh, it's just old age. And, you know, they'll tell you at 40, your body breaks down and I'm feeling all these aches and pains. But, you know, I just began to tell her, don't ignore. If it's something that's consistent, like, don't ignore those pains. Be proactive and find out what's going on with your body. And so she ended up being diagnosed with arthritis, like rheumatoid arthritis. And who knows how long, you know, it had been going on. And just because she was thinking, oh, it's old age and it's progressing, I feel like she probably could have jumped in front of it, because there are things that you can do to assist your body and help, you know, those things reverse in the beginning, if you are proactive in your health. And yeah, so we've had that conversation, and now I have the conversation with my nieces, even with my sons. You know, I have a conversation about how important it is to pay attention to your body, as well as be an advocate for your health. Because I didn't share this, but I had actually gone to the doctor an entire year before I was diagnosed. I had gone to the hospital, I want to say maybe 2 or 3 times, and they gave me the same scan that my heart doctor gave me, but no one ever mentioned the nodule that showed up on the scan. So if I had given up on what I was feeling, that was something was wrong with my body, then who's to say what could have happened today?
So true, Latoya. So true. Anybody?
Yeah, I think, just about talking to our parents and all. My mom is, she's 67 now. She's really active because she lives on a farm, but, you know, she's been having joint issues for a while now, and she was diagnosed with osteoarthritis. So she's been on painkillers and calcium supplements. It's a combination: calcium, magnesium, vitamin D. And yeah, she really keeps active, and she impresses it upon us to be active as well. And now when it comes to my children, you know, the children we have now, teenagers, are not like us, because when we were teenagers, we were out and about a lot. Right now, they are with their laptops, they're with their phones. So I actually sometimes take away their phones and send them out. Then they ask me, what are we going to do outside? I tell them, I don't care. Just go to the road and count cars. I just don't want you in the house for the next 1 hour. Just go, because they can lock themselves in their rooms the whole day. I tell them, you need some sun, you need fresh air, you need to exercise. So I'm conscious now about it, and so I force them to go out. I also do my walks. Before breast cancer diagnosis, I was really active. I used to work out a lot, but I think with the fatigue that came with treatment, I'm not back to my old strong self. So I'm slowly building that up by, just doing walking with weights and a little bit of dancing. And I will definitely get there, because I have to be an example for these couch potatoes of mine. I don't want them to reach a point where, we'll start dealing with other health issues just because they were not moving out and about enough. So yeah, we need to really make people around us move, our friends, our siblings, and anybody, just make noise about it, especially to women. We must do something about our bones, love our bones, #love our bones.
Yes, definitely. I love that. I think that's actually a great place to even just to wrap up our conversation for today. I can't believe the time has gone by so quickly. This has been so informative and useful for all those who participated. I'd like to especially thank our panel, Latoya, Brooklyn, Eva, Ebony, for your openness, for creating a space, for taking time out of your schedule, because this is so important to you to be able to share about your journey, to be able to share about what you learned about bone health, and to share information with others. This has been such a great space. Even those who have been the participants who have been in the chat, to be able to share some of the different natural ways that they have been able to try to supplement without having to use estrogen, not being able to have that, but be able to find different ways to continue on to get that support. So I'm so glad for this community and this space, and for you all taking time. We will share this recording on our YouTube channel afterwards. And I did want to share on our chat as well, share my screen just for everyone to take a screenshot of all of our phenomenal panelists so that you can be able to follow them on social media and reach out to them, as well as if there are any participants in the chat who would like to keep in touch, please drop your email address in the chat so we can keep in touch with you as well. But take a screenshot, make sure to follow us. We're going to keep the conversation going. This is for the next, throughout the rest of the month of April. We're still going to be, Tigerlily, we're still going to be posting and sharing about bone health. Next month is Osteoporosis Awareness Month. So some of our partners, for instance, the Bone Health and Osteoporosis Foundation is going to be having tons of conversations about bone health the entire month of May. So we are going to be sharing our Tigerlily newsletter on next week for April, as well as sharing some of the stuff for May. So you'll be able to see a calendar of some of those events that they're having so that you can be able to tune into those conversations. So this is just the starting point, as well as our, Denisha, if you could put our Love Your Bones, our bone health, we have our bone health channel, Bone Health and You, Tigerlily Foundation site that has a bunch of different blogs and nutritional videos. We have in terms of like walking and exercise, we have our Pure Cat classes that you can sign up for on a weekly basis to be able to stretch, to have some of those yoga, to be able to do those things, and they're all complimentary. So I really invite you to participate in those when you have a chance and opportunity. And thank you for holding space. This has been such a great conversation. I know today is also Earth Day, so get out there if you can, get some sunshine, just walk if you can, stretch a little bit, and make sure to take care of your bone health. I hope you'll have a wonderful day. Stay safe, stay blessed. Remember to stretch, and let's continue to increase our bone strength one step at a time. Take care, everybody.